There's no doubt for me that after I had my knee surgery, the replacement of the knee, that I needed a partnership to help me to get back to where I wanted to be. And that's where Faith Regional came in, and they did such an excellent job with the education piece as part of this. I got a notebook. It was called Orthopedics in Motion. Read the notebook and it said, try doing these things before surgery. And so I did. I spent 30 days doing some prehab work to strengthen the muscles and prepare for what was going to come after. And then we had the Orthopedics in Motion class. So my wife and I went to Joint Camp. It was about a 3-hour education experience to learn more about what was going to happen. And we got to hear from our nurse navigator. We got to hear from the physical therapist department. We got to meet with the anesthesiology department. Just really kept us informed all along the way of what was going to happen. The day came, I went to the hospital at 7 o'clock. I went to surgery at 11 o'clock. I was back in my home at 6:30 with a brand new knee, and they started me on my physical therapy plan. And it's not a 3-day-a-week program. It has to be a 7-day-a-week program, and you need to commit to that. My summary statement is, do the work, go win the day each day with that knee recovery and the rehab, and you'll be fine.